Sir, we are live now. With all your permission, I am starting this session for today.
Okay.
A very good evening, everyone present here. I am Faraz from IJCP Group. Welcome all the participants on today's session. And for today's session, our host is none other than Dr. R.M. Chabda, sir. And let me share some of the achievement of sir. Is a senior consultant physician at Max Salimar and Sarosh Super Specialty Hospital, and he is senior director and HOD of pediatrics at Max Super Specialty Hospital in Shalimar Bagh, and he has many achievement during their career. And today's session topic is holistic approach to vaccination for all ages. Now I would like to invite sir and proceed with the further session, sir. Over to you, sir. Stage is yours. Kindly proceed from here.
Thank you, Mr. Praj, for the kind words. First of all, I would like to thank you, MedTalk and the IJCP for giving the opportunity. So we will discuss the holistic approach in the vaccination or the vaccines in all age groups. We have very eminent speaker with us, none other than Dr. Pravinder Singh Narang. He is a HOD and Director Pediatrician and Max Super Specialty Hospital, Delhi. And he is MBBS from graduate from the Maulana Azad Medical College. And he has the 40 years of the experience in the pediatrics and editor of the 10 books, Child and its Health, both the English and Hindi, president of the IAP, Delhi North Zone, he was president of the IAP from 2013 to 2014, executive member of the IAP Infection Disease Chapter 72-18, and president of the Svera Rehabilitation Institute of Children with the Special Needs and NGO serving the children with the physical and the mental challenges, and regular contributor to the NDTV, Republic TV, and the new media. And he special interest in the cricket statistician, the All India Radio and Delhi Doordarshan and the Radio Australia. So today we have been allotted the holistic approach to the vaccination for the all ages. So dear friends, there are 10 threats to the global health according to the WHO: air pollution and climate change, non-communicable diseases, fragile and the vulnerable setting, Ebola, and other high threat pathogens, weak primary health care, dengue and HIV. Another this is the global influenza pandemic. Another is the antimicrobial resistance, very common all over the world, especially in the India. So if we talk about the vaccination hesitation, it is very known, the vaccination hesitation. So today we'll talk about the vaccination and its a holistic approach. Before going to my topic, I would like to say something about the human behavior or the human life. What is the age? The human life or the age, it is a cycle from the birth to the death. And to keep ourselves healthy and fit throughout the life is an art. Health and fitness are the interrelated terms. And if you talk about the personal health, as per definition, when a person physically, mentally, socially, and spiritually is healthy, then we can say a person is healthy. If person is healthy, then the immunity will be strong in that person. So if we talk, what are the sources which keeps our body fit, healthy, and the tune to the work and keep our immunity strong? That is the food we require daily. In the car, we require the fuels, carbohydrate, protein, fat, minerals, and the vitamins. Another water and fluid. So very, very important. That's why we say the water, the fluid and electrolyte balance. We should do it. So air is also important. Everybody see the importance of the oxygen in the era of the COVID era. So if you talk about the sleep, if you are having the adequate sleep, then you are fit. If over and under, both sleeps are harmful. If exercise and meditation, yoga, everybody knows these are very important to keep yourself healthy. If we talk, the future ahead will force our focus on this NII TED, that is a nutrient status, immunocompetence, and the body's ability to fight against the infections. If we talk about the nutrition, if there is a poor nutrition leads to the compromised immune system, what will happen? If you are having the hectic or the stressful lifestyle, fast food, energy, tense, and the low income group, and the sedentary lifestyle, and restricted diet, all will lead to the poor diet. Poor diet that will lead to the suboptimal nutrition status. If there is Additional factor, the chronic stress or the psychotherapy or the pollution, cigarette smoking, sleep disturbances, or the deprivation, and excessive alcohol consumption, prolonged exercise that will lead to compromised immune system that will increase the risk of the infection. So nutrition, immunity, and the infection are the interrelated terms. Malnutrition will lead to the decreased immunity that will lead to the prone to the infection of either viral, bacterial, fungal, or etc. anywhere from in the body. So if we talk according to the WHO guidelines, protection from the infection of the three types from the body, surface and space. That is the surface and space and surface. Both are the external protection and body is the internal protection. These are the according to the WHO guideline. If we talk about the immunity, there are two types of the immunity, adaptive and the acquired immunity. Adaptive of two types, either natural or the artificial or the acquired. In the natural active, antigen enter the body naturally, body induces the antibodies and so to the specific pathogens. According to the passive, the antibodies passes from the mother to the fetus via the placenta or to the infants via the mother's milk. The active, artificial or acquired immunity antigen are introduced in the vaccines on the body, produces the antibody and to the specific pathogen. And passive, the passive preformed antibodies in the body serum are the introduced by the injections. Today we will talk about the vaccination, the active acquired immunity. So today is our topic. So what is the importance of the vaccines? The world WHO says between the 3.5 to the 5 million deaths are prevented each year by the vaccination for the preventable but life-threatening diseases like the diphtheria, tetanus, pertussis, influenza, and the measles. If we talk the prevention, these are the prevention. We have to prevent the disease. So prevention of the disease is very important. Prevention is better than the cure. In this picture, you see even this guy proposed to her girl with the full precautions. The prevention is a very, very important. So what is the difference between the vaccination and the immunization? Although they have received the life-saving antibodies from their mother, however, these antibodies gradually diminish, which makes them susceptible to the infection and the disease. Immunization forms a cushion that immunizes them against the deadly infection by the administration of the vaccination. So the question to the first question to the PS Narang, throw light on the vaccination and what is the difference between the vaccine and the vaccination? Differences, brief history, and who is the inventor of the vaccine. Doctor, over to the Dr. B.S. Narang. I am stopping my screen. Here your screen,
Thank
please.
you. Thank you, Dr. Chabra, and thank you for allowing me to share my screen. And we start with the presentation. And basically, Dr. Chabra has set up the control very well. And I think what is holistic approach to vaccination for all? You have talked about these threats, you have talked about immunity, and you talked about this.
डॉक्टर नारंग ये फुल स्क्रीन कर लीजिए आप इसको फुल स्क्रीन पे कर लीजिए
हाँ मैं कर रहा हूँ okay it's full screen now.
Yes, now it is okay.
I'm going to talk about some history, opposition to the vaccine, as you rightly said, vaccine hurdles. We have, as a vaccinologist, must combat the misinformation. We have to tell the achievements of the vaccine, recent development, current roadblock, and the purpose is vaccine to vaccination. And what are the future protection vaccines available? Well, beautiful girl there, her name was Jesty. 1744, it was the year. And historically, they noted that the girls living in Yetminster, Dorset in UK were beautiful milkmaids. Edward Jenner, although invented the vaccine, but Jesty's father, Benjamin, noted that those girls who get the cowpox doesn't get the smallpox. So in fact, he vaccinated his wife and two children, but didn't go any further. It was to Edward Jenner to diagnose that cowpox virus, if injected in a very, very crude way. The crude way was that they took the inoculum from the pustules and then injected into the patient. And this was already given, and this wasn't accepted very easily. There were a lot of problems, and when they tried to do it, Edward Jenner, but result was the discovery of the vaccine. And then, within that span of some more years, Jenner and Louis Pasteur discovered 33 vaccines. By 1819, they had vaccine for typhoid, they had vaccine for plague and cholera. And where this word vaccine came from? The word vaccine came from vacca, which is the Latin word for the cow, because the cowpox virus was the first one to be used as a vaccine, combined with Louis and Jenner, so they called it vaccine. And it was Louis Pasteur who said that the transmissible diseases are caused by the microorganism, not some kind of god and some kind of spontaneous diseases. So there, this discovery and the various vaccination, and slowly further things occurred, like that you started vaccinating children for pneumonia. You started vaccinating them. The first was reduction of, because this was started in the first year of life, reduction of disease. 90% most of the country, 100% in Norway, 70% in Israel, Australia, Zambia, Denmark. So the countries were vaccinating for pneumonia, and slowly, not only slowly, immediately they discovered, when they started the vaccination in 2007, they discovered that the diseases got reduced in adults as well. So what is the reason? The reason was these children were bringing in infection from school, from society, from community, and spreading it to the adults and to the old people. And the old people were the vulnerable. So just by vaccinating only children below 1, the reduction of adults above 65 was a huge number. So Dr. Chabra, this was the something that led to that the vaccination is for everybody. Vaccination to be given to everybody. Not only that, we have started to understand how these vaccines come, what are the sources. And in case of influenza, children are the primary vectors of influenza. See, the thing is, children themselves don't suffer. They have a very good immune system. We saw that in COVID as well. In the first phase of COVID, children already suffered. They were able to control the infection quickly, but they were spreading it to the others, family members, older children, and adults. When they clear the infection is cleared in a way that by adaptive immunity. But in children, sometimes they can clear the infection only via their T cell. If T cell are able to kill the infection, the antibodies are not raised. But they get the antibodies, they clear the infection, but this harbor the virus for a longer time. And when they were harboring the virus for a longer time, they themselves don't suffer, but it leads to more infection in the community. So children get the vaccination, they get better, they also don't spread to the others. And the benefit of vaccinating children were noted because they themselves missed less school days. They were not given antibodies. So we don't have to worry about the antimicrobial resistance. Their mothers didn't have to take leave from the work. The parents didn't have to take the leave from the work. So they were not only getting themselves better, but they were reducing the suffering for all. Next question, Dr. Chabra.
Next question.
Is regarding the vaccination, antenatal,
Yeah,
postnatal.
just a minute. Next question. What are the symbiotic benefit of the vaccine children and the adult in the family? If you vaccinate the children, and what is the benefit to the parents? Or if you vaccinate the parents, what is the benefit to the children? The very
I have just said that by vaccinating pneumonia in children, the adults 65 plus didn't suffer. By vaccinating influenza in children, the adults don't suffer. The parents don't miss the school. The parents don't miss their office. So
Okay.
this is, sir, actually the when you vaccinate children and you vaccinate in large number, you also get the herd immunity because the virus or the bacteria needs person to spread across. So if the disease is stopped from spreading, the herd immunity comes. And also we note that this vaccination schedule for influenza is going in UK for almost 6 years. They are vaccinating all school children by live attenuated vaccine, which can only be given about 2 years. And for the last 5 years, when they are vaccinating all children in the school, and it's non-injection way, uh, the other persons in the society are not getting infection. So all the GPs in the surrounding areas, whenever they get any patient with influenza-like illness, wherever there are children who are getting vaccination, the disease burden in adults is very low in those areas. So that is the symbiotic benefit. So these are very, very important.
Dr. Narang rightly said this is a symbiotic benefit. If we talk about the herd immunity, it is for the community or the group or the large population, not for the. It is. Would you say like to say it is a cross immunity in the family or the
Sir,
herd?
actually, let me explain now. Take an example that we have a person who is undergoing chemotherapy in the house.
Yeah.
Okay. We have a person who has a low immunity or some kind of a problem where we can't vaccinate him.
Mhm.
So if we vaccinate the people who are around him or around her, then those diseases which he or she can get from community, if we vaccinate people around, this is called cocoon theory. In the cocoon theory, you are protecting the environment. As you rightly said, you are protecting the environment by good nutrition, you are protecting the environment by your external protection, keeping a good hygiene. So these are the ways of actually providing additional benefit to the people around you. And literally at the moment that whosoever is handling the small baby, because in the first 2 months they have a antibodies from the mother, but they don't have vaccination yet. So whoever handling, if they take the vaccination for pertussis, influenza, these are very important. And here you also see that prenatally the mother is vaccinated for all diseases. Antenatally, we further vaccinate her for DTaP and influenza. Because in antenatally, we can only give the killed vaccine. We can't give the live vaccine during the pregnancy. We can give any kind of a killed vaccine. But in prenatal time, if she is vaccinated for rubella, measles, mumps, then the child doesn't get the rubella disease. So these are very, very important. You know, when I've got the next slide on my board, these are the 12 diseases which our government now has included in the national immunization schedule. This is BCG, hepatitis B, polio, DPT, Hib, Rota, MR, Japanese encephalitis in some areas, and pneumonia, and followed by boosters of DPT and followed by boosters of TD.
Mm.
When you cover these 12 diseases, then obviously the burden of these diseases in the community also get reduced because you are covering their adults and everybody. And look at this schedule. Now I'm specially showing this schedule because a lot of people come to us at 2 years that the vaccinations are incomplete. Vaccinations are not complete. It goes from 0 birth to 65. Rather, I will say the vaccination is first for prenatal. The mother who is going to, or the couple who is going to have the baby, they must take all their vaccine. And in prenatally, if mother is not vaccinated for MMR, chickenpox, even those vaccines can be taken prenatally. And after the vaccination of the live attenuated vaccine, such as MMR and chickenpox, she should avoid pregnancy for 3 months. And after that, they can take the pregnancy. And during pregnancy, we rightly say DTaP and tetanus is required. We rightly say influenza is given during pregnancy. And these two vaccines given during pregnancy prevent children, because we start DTaP vaccine in children at 6 to 8 weeks. So the first 2 months of the child, before they receive any vaccine beside BCG and hepatitis, they are covered. So prenatally, antenatally, then throughout, and throughout the booster, 4 years, 5 years, 10 years, and 18 years, and followed by the adult vaccine.
Very good. Next question to you. What is the schedule, national schedule for the vaccination just after the birth and pediatric group and the adult? I will ask later on about the ANC and DAC and the child vaccine. You tell me the national schedule just after the birth, pediatric group and the adult vaccination, male and female both.
The very clear message here that we give at birth hepatitis B.
Can you show me the slide?
Yeah, there is a slide already.
Yeah.
We give BCG, hepatitis B, and polio right at birth. Why we give right at birth within the first 48 hours? Because before the child is discharged from the hospital, this vaccine is done. And especially for hepatitis B, quite a significant percentage, as much as 30 to 50% of hepatitis B transmission is vertical. And not all our deliveries are screened for hepatitis B. Not our mothers all are screened for hepatitis B. They should be screened for hepatitis B, hepatitis C. But because they are not screened, if we give hepatitis B at birth, then this will prevent that vertical transmission. And we don't count, we call it a 0 dose. We just give it within the first 48 hours, and then we give 3 doses of DPT, hepatitis B, IPV, and PCV, and oral rotavirus at 6 weeks, 10 weeks, and 14 weeks. That is in the primary vaccine. Followed by 6 months influenza, which is not given in the national schedule, but the Indian Academy of Pediatrics recommend 2 doses of influenza in the first year starting at 6 months. Then at around 9 months, we give either MMR or MR. MR is given in the national schedule and MMR is given in the private schedule. Doses of typhoid, hepatitis in the first year, 9 months to 1 year, followed by 15 months chickenpox. And then comes the booster at 1.5 months, 16 to 18 months. This is booster of DPT, Hib, and IPV. And in one-to-one basis, we also give them the vaccination for meningococcal, Japanese encephalitis, or other pneumonia vaccines. After the 1.5 year, the vaccine is for hepatitis A, and then at 4 years are the booster, and then booster at 10 year, and at 10 year you give also, and is going to come in the national schedule very soon, HPV, human papillomavirus vaccine for both boys and girls, which will prevent the genital warts and the cervical and other cancer. So this is going to go 18, and then comes the adult vaccine. But before that, there are other vaccines in the catch-up schedule. So whenever you miss the vaccine, there is always a chance to catch up. And whatever doses, say for example, the patient has missed 2 doses of DPT, we don't have to repeat all the 3 doses. You can repeat only 1 dose which is left, followed by the booster doses. So the catch up, whatever has been given, should be counted and the catch up is given. So the parents then are convinced that whatever they have done, although it's not the ideal, that ideal is to follow the schedule. And then there are vaccine in the special situations. The special situations are the comorbidity. If the child has some kind of respiratory infection, predisposity, or immune deficiency, then meningococcal vaccines, other vaccines like the PPSP4, yellow fever, all this can be done. Then you come to the adult vaccine. So, first of all, any missed vaccination, there is a delay, but it's all delays are manageable, including all the vaccine which has been given. Sir, what is then the adult comes to? Adult always feel that they don't require any vaccine, but in adults, it is very important that they need the vaccine because they develop the comorbidities with the stress, smoking, adult onset diseases, and presence of the chronic diseases. So adult also have a lower immunity. They have more complications with the disease. Like I said, when the children are vaccinated, uh, then the children don't spread the infection to adults. Children themselves clear the infection, but they spread the infection to the vulnerable, and then they have the problems. So adult also need all the vaccine like these ones: pneumococcal, influenza, DPT, herpes zoster after 50 years, and MMR also for adults if they have missed on or they don't have the antibodies enough in their blood. Human papillomavirus starting at 10 to 45, and similarly hepatitis B, A, meningococcal, and COVID vaccine. So adults need all the vaccines which are there because it's a vicious circle. If adults are vaccinated, they themselves are not getting infection, and if they are not vaccinated, they will get some serious infection.
Nicely said. The adult is very required because the adults are the immunocompromised due to the smoking, stress, and all that I have told you in the nutrition factor. They are compromised immunization. That's why they require the immunization. The adults are very vaccination for the adults is very important, I think. If they missed, then it is manageable. They can take later on. Am I right?
Yeah, absolutely right. All vaccines, those are missed, those are skipped, can be covered.
Okay. So next question is, tell me something about the travel vaccines. What are the travel vaccines which are required if you are going abroad?
Sir, absolutely. Let's put the situation because the travel vaccines are sometimes more required when people are coming from abroad. We need the travel vaccines such as a yellow fever vaccine. We need a travel vaccine such as a meningococcal vaccine. Yellow fever vaccine is for all those who are going to uh, all the African countries, and South Africa, they require yellow fever vaccine, and to be given at least 10 days prior to your travel. If you've taken the yellow fever vaccine, and your travel date is in a week or 10 days, you will not be allowed to go. People going to Hajj also are given the same thing. Now, sir, mostly the travel vaccine are mainly when people are coming to India or going to African countries. For them, the travel vaccines are such as hepatitis A, typhoid, Japanese encephalitis, and other diseases which are available, which are more prevalent in developing world and Asian world. So these are very important. And I like to show you that this is the chart of NHS, and the chart of NHS is quite different to us, but it is similar like DPT, they are giving 3 doses. Now look at the meningococcal. They have, I mean, we also have meningitis, but look at the meningococcal. They give within first year 5 doses of meningococcal, 3 doses of Men B, 1 dose of Men C, followed by a dose of ACWY. Now, although if you say meningococcal happens in India as well, but meningococcal is a very costly vaccine. We also need it, but of course, for the financial reason, we can't give. But they are giving 5 meningococcal vaccine in the 1 year because they want to stop every single infection. And this is very important. And with this attempt, they have reduced the dosages, and they have reduced the dosages of, they were using meningococcal for the last 5 years. They were giving 2 doses of Men C, now they reduced down to 1 dose. They are still giving 3 doses of Men B. They were using 4 doses of pneumococcal. They've reduced it down to 2 doses now. They were using 2 doses of HPV. They've reduced down to 1 dose now. And that is when the coverage is a mass coverage, more than 95%. Only then that is possible. So these are the things that whereas today our national schedule is giving 3 doses of pneumococcal to all children, and privately we are giving 4 doses. And if we vaccinate more than 90%, then we can, same doses can double our coverage. So this is what is very important. So travel vaccine and all these are very, very useful by this way.
Okay, you have to take it before going to abroad. So, Dr. Narang, I will ask you some practical question, some challenges. In what ways the parents can, you are the senior consultant pediatrician. So, in what ways the parents can be energized or the motivated for the vaccination, especially if the vaccine is possible injectable? How do you motivate them?
Sir, absolutely right. So when the patient comes to me for a checkup, I give 4 checkups to that patient. As you, in the right, your first slide, you said health is physical, mental, social, goodwill. So you start with the good advice on growth. You start with the good advice on nutrition, good advice that how to prevent infection. And you say, I've written there sanitation, clean drinking water can stop diarrheas altogether. If we give good hand hygiene, good sanitation, good drinking water, then 80% of the communicable diseases can get reduced. And then you give them development check, and then you tell them that further diseases can be prevented by these diseases. This is a very, very good slide, sir. What has vaccination achieved so far? These are very, very good. Smallpox eradicated, poliomyelitis almost eradicated, except some countries around us, Pakistan, Africa, have some. Measles eliminated in many countries like America, Europe. Other diseases like diphtheria, and as I said, meningitis, Haemophilus influenza, they are not, they are very much reduced in developed countries. Hepatitis B, almost gone from China and Taiwan. Country like Israel took hepatitis A for all their children. We are not giving, we are only giving hepatitis B, but hepatitis A to selective children, they eliminated. Simple diseases like chickenpox, you call them that these are mild diseases. But regular vaccination can prevent even herpes zoster. So these are very, very important achievements to show to the patient. This is the something which can sometimes happen, the consequences of interrupting vaccination program. DPT vaccination started in England and Wales in 1940. It was a wholesale vaccine. Okay. Immunization started, the disease got reduced very well. It almost came down to less than 20%. But then the wholesale vaccine was causing fever to the children. Okay. Quite a few countries like Sweden, Norway stopped taking wholesale vaccine because the fever was because of the pertussis wholesale. Look at the result. Vaccine uptake down, the disease came up. People were worried about the side effects when the disease is reduced. They were not worried about the side effect in 1940s when the disease was high. But then came a safer vaccine and now pertussis again reduced. So you have to tell to the parents, this is the resumption of the confidence, that increased coverage will bring some outbreak, but resumption of the confidence will bring that confidence and the people will start taking the vaccine, and then slowly we will eradicate. So this resumption of confidence at the loss of confidence is very important in any vaccination program. Obama from America, when people were reluctant to take the HPV vaccine, and the coverage in America during Obama time was only 20 to 30%. He raised a slogan that to reduce the various genital warts and cancer, he told to the GP, advise them for 3 vaccine, DTaP, meningococcal and HPV at 10, and his slogan was, give me your arm. So when you give a lot of good information to your patient, resumption of the confidence will come, and then these hurdles can be stopped. Dr. Chabra, these hurdles are not easy. They are religious. We still had in pulse polio religious hurdles that even the oral they were not taking. Philosophical, political, financial, yes, I said about meningococcal, very good vaccine, very deadly disease, but the cost of the vaccine is huge. I can't give a national coverage on that at the moment, and hopefully in 2040, the way India is going, that will also be there. We should never allow the press to give irrational comments. We should never allow advertisements the social medias, which sometimes bring, my child had fever following this, my child had this, and he was unwell. So you have to see that the infant mortality in India also has come down drastically. It used to be more than 100 per thousand. Now it is much less. So we have to come above all this stupidity, irrational comments, and our stumbles, and this will reduce. Comments like 1 in 100,000 polio can cause paralysis. Comments like 1 in 10,000 can cause encephalitis. So these are the very, very wrong ways of reducing the vaccination. So good communication with parents is important.
Communication is very important. The education is very important. You should not compel the person for the vaccination, but you should convince them and show them the benefit of the vaccine. As you rightly shown the slide, that is smallpox eradicated and polio almost eradicated. Very good slide. If it is shown to the people, then the people will be convinced, definitely convinced. So convincing is important. Don't force them to take them, I think. Am I right?
So actually, when you say don't force them, I think if you convince them, they will come forward to take the vaccine. I mean, obviously, that verbal consent or a written consent is always taken in such cases. The 4 Nordic countries like Finland, Sweden, they are making vaccination compulsory. And I want to give you one example. When people go for Hajj, they take the meningococcal. When people go for US for visa, students go for education, they complete all the vaccination which are pending. I mean, only 2 months ago, one of the patient went for a American immigration, and they pointed out that not visa but immigration. They pointed out these 7 vaccines are pending. So the lady took all the 7 vaccines there and there in the embassy. She did not objected to any single one because for her immigration was more important. So and they were not allowing. So she came to and tell me कि सर आप कहते रहते थे कि मेनिंगोकोकल लगवा लो और इसका डी टैप रहता है. तो मैं जब अम्बेसी गई, उन्होंने बोला either you take the next date which is available 3 years later or you take all the vaccine.
मजबूरी में भाई है.
तो कई बार ये देखिए पेशेंट को आप जबरदस्ती नहीं लगा सकते, बट लॉट ऑफ टाइम सेम पेशेंट when they have to travel and the visa compulsion tells them you have to take it, they take it.
Yes,
so
definitely.
as a country, our politicians should also give us good. And Amitabh Bachchan is advertising for herpes zoster, and I must appreciate that is very good.
He is advertising for the polio vaccine, I think.
No, polio also he's recently started for herpes zoster as well.
Yeah.
पोलियो तो ही ऑलवेज सेज कि 2 बूंद पिला दो, मैं कह के थक गया हूँ.
Very good. Nice. Dr. Narang, as you said, the consent is required for the vaccination. You talked about the consent.
Sir, we in our clinic we always take. There are 2 ways. One is implied consent. When the patient comes to it, the implied consent. Written consent is not required, but implied consent means that you have explained to them that these are the things. And I tell to all my doctors friends that in your clinic must keep proper inventory of your vaccines, that they are not expired, they are stored properly, and you have oxygen in your clinic. You also have adrenaline, hydrocortisone in your clinic in case of reaction. And you tell the patient to wait at least 20 minutes or 30 minutes following vaccination in the clinic for these kind of reactions to occur, which occur very rarely, but if this is there.
Okay. Now we will take the quick question because time is very short. And what about the malaria and the dengue vaccines?
Sir, okay, I will take that question first. Don't worry. So, first of all, at the moment, these are the projected vaccines.
This is a question from the Agra.
Okay.
Somebody has sent me that.
Sir, malaria vaccine and dengue vaccine. We had a dengue vaccine. Dengue has 4 viruses, 1, 2, 3, 4. We had a dengue vaccine which came into practice, and it came into practice. It was started in some countries in Southeast Asia, but it was not giving a good coverage to all the 4 viruses. it was stopped. There is another dengue vaccine which is coming. We need that it should give coverage to all the four viruses. Sir, Dr. Chabra, as you know, that dengue can happen 4 times. First time it is less severe, second time more severe, and subsequently more severe. So if I give a dengue vaccine and it doesn't give good coverage to all the four, and if incidentally the number two virus was a problem, and incidentally two occur, then the disease will be severe. I repeat, 1, 3, and 4 was a good coverage. So 1, 3, 4 will be eliminated. But if the patient get 2, then the coverage will be. Malaria vaccine again is going to come soon, and
Yeah.
we have in pipeline
We
HIV.
have to wait. Yes,
and
it is a
AIDS.
pipeline. We have to wait. Acha, what is a very good question from Dr. Praveen Bhatia from Delhi. Rabies being a 100% mortality disease, what are the challenges being faced by the government towards the eradication of the rabies? What is the inertia on the part of the vaccinologists advisory of the government of India? What is your
Dr. Bhatia, this question is very, very, very good. And I'm not making a statement, a universal statement, but see, most of the dogs are stray dogs. Most of the children and most of the morning walkers are unimmunized. Okay. They only take post exposure prophylaxis as and when required. Pre exposure prophylaxis is not routine, but I am recommending when your whole population of dogs are not immunized and you are a morning walker or you're unimmunized school children, then pre-exposure prophylaxis should be routine. And at the moment, I will say to Dr. Bhatia, the pre-exposure prophylaxis should be offered as per if you are keeping dog at home, if you have a pet at home, then pre-exposure should be a routine. Pre-exposure prophylaxis, I will say, if taken, then the biggest thing is then you do not require rabies immunoglobulin, which are quite costly. For adult, it costs around 12,000, and for children as small as 10 kilos, it costs around 3,000. So the those children who are pre-vaccinated, those adults who are pre-vaccinated, they do not require rabies immunoglobulin. And I'm not making a statement that everybody should take pre-exposure prophylaxis, but I have taken pre-exposure prophylaxis of rabies because I go for cycling, and a lot of time dogs run after you when you're cycling, and it is very, very disheartening that you want to do exercise, but you do exercise in a fear. So these are very important for total eradication. I say vaccine is 100% preventing the rabies and disease is 100% fatal. So best is to take the vaccine.
Okay, very good. Another question from the Harbanslal Khurana from the Hoshiarpur. What are the latest recommendations of the HPV vaccination? Should males also receive this vaccination?
Very, very good question. Sir, if I have to say that both males and females should receive the vaccine, and it is more important for males as well. Sir, the cervical cancer vaccine, in fact, the biggest stumble and hurdle in India was because it was advertised as vaccine for girls. It is wrong. It is a vaccine for both. This HPV, natural infection, Dr. Chabra, is very important when I'm saying natural, every disease, diphtheria, tetanus, pertussis, natural infection gives you immunity. Okay, still you want to take vaccine because vaccine doesn't give you disease, it gives you immunity. But natural HPV infection does not give you immunity. The natural HPV vaccine is a localized cell infection. It is not crossing your dendritic cell. It is not crossing your B cell. So if you have HPV natural infection, it does not give you immunity. Rather, it makes you more prone for the same virus to cause infection again. And this is more in males. So if I have to give that both males and female, then I would say male is more important. If you have HPV 16 in a male, he will have HPV 16 again more frequently than a female partner. And almost 80% of the persons will get all these infections. And again, the stumble is it has got nothing to do with puberty. It has got nothing to do with periods. It has got nothing to do. Only thing is during pregnancy, we haven't got enough evidence to give, but we can give even in breastfeeding. We can give in any age starting from 9, and 9 to 14, they require only 2 doses. And the HPV second misnomer is only for cervical cancer. No, it is for other head and neck cancer, it is for anal cancer, it is for neoplasia, it is for genital warts, it is for penile cancer. So HPV causes more cancers than only cervical cancer. And look at the incidence in India. 1,25,000 annual incidence, vaginal cancer, penile cancer, oropharyngeal, and genital warts within. If you give national immunization HPV, countries like Australia, South Africa, the genital ward is reduced. The CIN 2 and 3, all those which have taken the HPV in national schedule, there are no CIN, which are the neoplasias. So it is reducing the neoplasia by almost like 10 years now, HPV. So it is very important in India. It is very important for both males and female. So this is the slide which I want to show to everybody. Two misnomer: don't call it a vaccine for girls. Don't call it a vaccine for cervical cancer. It's an HPV, human papilloma virus, for both males and female. And you get better response in 9 to 14. And after 15, you need to use 3 doses.
Very nice. It should be given to the both sexes, gender, male and female both, because it is not only confined to the cervical cancer only. Dr. Narayan, another question from Satpal from Rohtak. During the COVID or even the post-COVID era, there had been a lot of sudden deaths, even in the younger persons, while doing their routine activities. These things were highlighted by the media too. Media postulated that such deaths are because of side effect of the COVID vaccine. Is it myth or fact? What is your
opinion? Sir, it's absolutely wrong. And those adults who were not fitness freak, they were not taking good diet, they were not in kind of a proper. As you are a physician, you don't tell the patient and go and jump on the treadmill and do 30 minutes at pace of 10 first day. You tell them to improve. You tell them to rule out the diseases. When they are doing it, they all have some underlying medical condition. They may have some chronic diseases. They may have diabetes, kidney, liver. And look at that BMI. A person who has got a very high BMI, he should not suddenly jump onto the and start doing all these exercises. They must take a good medical advice. They must build up their stamina, and they must do the exercises in a very, very proper way. And taking anything which is beyond your capacity can be harmful. And today I saw Mr. Sharma, and I could not pass my exam. So Mr. Sharma is not responsible for that problem to me. It is my preparation which was not good. So this is very important message, that don't relate the things randomly. Even, sir, MMR and autism, even many other diseases are there where people have blamed that they are caused by MMR. So even today, I get patient who says I don't want MMR because it causes autism. So these are all, and press we tell the stumbles. These are all stumbles, and they are not happening the way it should be. Those, look at the 99% who are benefited. Okay, so these are not. I don't agree to any such thing.
Okay, it is a not fact. It is not true. Only myth, I think. Dr. Narang, very nice discussion. So there are so many questions, but you have answered in your presentation. Every answer you have been given. So in the last, what is your take on message regarding the vaccine at all ages? What do you take on message?
I've
You
already
stop your
I've already-
screen. Dr. Narang, stop your screen.
No, I've put the screen. I want to put the screen.
Okay. Okay.
Sir, Seko, I have already highlighted vaccine for all. I already highlighted the vaccine for all ages, healthcare workers. Sir, they can spread it to their patient. They can get it from their patient. So the health of both are important. So my sincere request to all my colleagues, all health workers, that they must take their vaccine properly. They must take influenza every year. They must take DTaP once in 10 years. They must take precautions for pneumococcal by PPSV 13 or 23 and other vaccines. So these are, when you are treating, you don't want to get infection. And in nutshell, sir, this is a slide which I want to show to every person. Look at, you also face this thing. Patient called me during lockdown. सर वो वैक्सीन लगवाना था, बच्चे का रह गया, सर वो क्या, सर अभी करते हैं, सर अभी करते हैं ये. So whenever there is a scare, the day there is a report that in Delhi has more influenza cases, the next day I vaccinate so many patients. So patient called me during lockdown were a huge number, and once I opened the clinic, only few came for vaccination. So this is the most important. They will tell you that okay, will come, then they are scared. It's a pain होगा, पता नहीं safe है कि नहीं है. So always tell their parents that these are very good clinical practice. Vaccines are very effective, not 100%, but yes, more than 95, 99%. HPV 9 is 98% effective in controlling cervical cancers, and they must wait for 20 to 30 minutes in the clinic. And a government unity, doctors unity, public unity, and patient unity is required, that this drop on the leaf doesn't fall. So you please understand this slide, that there is a drop of water on the leaf, and if this patient moves back, the doctor moves back, the government doesn't give enough fund, or the public doesn't get confidence, this drop will fall. So control the disease, cooperation from all angles is required. My sincere request to all, don't go by negative publicity in the press. Speak to your doctor, do your exercises, take a good diet, and protect yourself not only by vaccination, by good hygiene and good nutrition.
Thank you very much, Dr. Narang. Now I can share my screen. Are you seeing my screen?
Yeah.
This slide is okay?
Yeah.
So, in the end, so in the last prevention, it means prevention is better than cure. Everybody knows. So, if you are a good doctor, the superior doctors always prevent the disease. Am I right? And mediocre doctors treat the disease before evidence. And inferior doctors treat the full-blown disease. Am I right? It is up to you. Up to you. You want to be a superior, mediocre, or the inferior? I think everybody wants to be superior,
Superior.
doctor. So I request you to prevent the disease. The vaccination is the only answer. You can prevent so many diseases with the vaccination. So in the last, I would like to thank you all for the panel discussion and the delegates who asked the question. I think Dr. Narang has answered all the question in well mannered, I think. So over to the organizer. Mr. Faraj?
Thank you so yes, sir. Thank you so much, sir. It was really wonderful session and wonderful discussion and much needed one. Like people will be getting aware about the vaccination properly. Like people used to do it, Google it, and try to become their own doctor, sir. But sharing this awareness, expert like you all will be really helpful, sir, and create awareness among the society, sir. And thank you so much once again. And hope to see you again with different topic on panel discussion in future also. And take care of yourself. We are closing for today.
Thank you. Thank you,
very
Dr.
much.
Chabra.
Thank you, sir. Thank you very
And
much.
thank you both of you, sir. Good night, everyone. Take
Good
care.
night,
And
good night. Take
I
care.
will say one thing last before closing. The show must go on. And फिर मिलेंगे चलते चलते आसपास, sir. Thank you so much.
फिर मिलेंगे चलते चलते नोट अलविदा नहीं कहना